Hello, I'm Dale Berry, certified prosthetist and owner of Prosthetic Xpert Consultation, a company dedicated to serving prosthetic providers, payers, and legal professionals to optimize care and support for individuals in need of prosthetic rehabilitation. This video presentation is to review documentation standards to establish and prove medical necessity as an integral part of the prior authorization process. Now, one would think for prosthetics, medical necessity would be an easy and straightforward procedure. After an amputation, common sense would dictate the patient is fit with a prosthesis, gets back up on 2 feet, and learns to walk. And thus, it would suggest that medical necessity for prosthesis is obvious. However, in reality, it's not quite as simple as that. Now granted, establishing that a prosthesis is medically necessary may be obvious and straightforward. But what style and type of prosthesis, what type of socket, what design of foot, what array of components are medically necessary for the individual to accomplish their activities of daily living? The first of 5 requirements to prove medical necessity is documenting patient status. To determine if a specific prosthesis is the most appropriate for an individual, it is essential to document the patient's current prosthetic-related physical and clinical status. This would include basic information such as patient age, weight, and specific amputation level. For lower limb prosthetic wearers, the functional level must be documented, as this has a direct influence on what prosthetic components would be appropriate and compliant. For the upper limb prosthetic wearer, it is essential to document the daily activity and dexterity demands for the individual, as this provides invaluable information in determining the need and appropriateness of specific upper limb components and technology. Now, the second requirement to prove medical necessity is to document replacement justification. Now, of course, this would not be necessary for a new prosthetic wearer and is only relevant when the patient has a prosthesis in need of replacement. Simply put, to establish medical necessity to replace a prosthesis, documentation must clearly explain what is wrong with the current device and why it needs to be replaced. When replacing a prosthesis, there's an important regulatory standard to be considered. Code of Federal Regulations, Title 42 states, a prosthesis that's been in continuous use has a reasonable useful life, or RUL, of no less than 5 years. Therefore, if the prosthesis is under 5 years old, documentation must clearly establish why the prosthesis did not fulfill the reasonable useful life of 5 full years. Replacement of a prosthesis can be justified for either one of 2 reasons. The first reason, change in patient condition. Now, this could be a change in functional level, change in the residual limb, change in weight, change in activities. Something has changed so that the prosthesis is no longer fitting the individual or is no longer capable of meeting the functional needs of the individual. The second reason to justify replacing a prosthesis is change in the condition of the prosthesis, which would typically be irreparable damage. The next requirement to prove medical necessity is to provide a detailed overview of the major components. Without knowing the specific style, type, and model of component being requested, the individual reviewing the prior authorization has no way to determine if the device is clinically appropriate or if the coding is compliant. By listing the manufacturer, make, and model of the major components, this streamlines the authorization process as it provides a clear and concise account of the specific prosthetics being requested. Validating recommendations is the fourth and arguably the most important documentation requirement to prove medical necessity. This is answering the simple question: why does this patient require this prosthesis? Note the question is not, what are the features of the device, or why do other patients like this style of prosthesis? So providing cut and paste statements from marketing brochure claims or testimonials of why other patients like this type of prosthesis, or providing copies of journal articles boasting various features, outcomes, and characteristics of a specific component is not relevant to establishing medical necessity for a specific patient. To prove medical necessity, documentation must identify the specific activities and demands of this specific patient that requires the features and functions of the specific device being requested. Validating recommendations is a matter of connecting the dots. The first dot is documenting the patient's needs and capabilities. The second dot is identifying the component features and functions. To prove medical necessity, to establish a foundation to secure prior authorization, clinical documentation must clearly connect these 2 dots. And the final requirement to prove medical necessity to ensure prior authorization is to enumerate the coding, to provide a detailed listing of the prosthetic L codes to delineate each component of the prosthesis being requested. While on the topic of coding, A common occurrence that can raise a red flag or slow down the prior authorization process is overutilization of 99 codes, specifically component unbundling. This occurs when a component has features that do not have dedicated codes, so the prior authorization is submitted with an exhausted list of not otherwise specified codes, either L7499 for upper limb or L5999 for lower limb prosthetics. The fact is, the component is purchased from the manufacturer as a single line item. The device is provided to the patient as a single component, and more importantly, none of the individually listed 99 code features can be removed or disengaged from this single component. Therefore, if medical necessity is being claimed based upon the cumulative features and function of the single component, then logic would dictate that it be coded and billed as a single line item with only one 99 code on the claim for the component. To assist in the prior authorization documentation process, I invite you to use the Proved Medical Necessity Evaluation forms available on my website at pxcrx.com in the download section. There's one template for upper extremity prosthetics and a separate one for lower extremity prosthetics. These templates are open access. You're welcome to use them without any restrictions. If you would like more information related to the prior authorization process to prove medical necessity, at my website, pxcrx.com, in the video section, there's a full 30-minute presentation on this topic that goes into much more detail and specifics. This full 30-minute presentation was awarded the Sam Hammontree Business Education Award as the best business presentation at the American Orthotic and Prosthetic Association 2020 National Assembly. Thank you for taking time out of your busy schedule to allow me to share this information with you. Be well, stay safe.